The first thing that a physician is going to be looking for in evaluating a patient for possible arthritis are going to be symptoms of joint pain. And we look for the distribution of joint pain. So some joints are affected more commonly in rheumatoid arthritis, such as the small joints of the hands and also the wrists. We will be listening for symptoms of stiffness of the joints. And stiffness is basically a limitation of motion. Patients who have rheumatoid arthritis often report that when they first wake up in the morning, they have a prolonged stiffness of their joints that lasts more than an hour or more before maximal improvement. And that's a very important symptom that we're looking for in screening for this condition. We're also looking for other symptoms that are not specific, but they're important in understanding the impact of the disease, such as chronic fatigue, which is a common symptom, and loss of function of the joints. And we use a variety of questionnaires that enable us to determine the level of disability that is being caused by the arthritis. Additionally, we would perform a physical examination, and it would be important to examine the joints for both tenderness, which is a feature of inflammation of joints, and also swelling. And the swelling is important as an indicator of definite joint inflammation. Finally, it's going to be important to do laboratory tests, and we would perform laboratory tests including the C-reactive protein and sedimentation rate, which are general tests for inflammation. And also we would be screening for autoantibodies that occur in rheumatoid arthritis, such as rheumatoid factor, and a newer test called anti-citrulline protein antibodies, or anti-CCP. That test in particular is very good at identifying those individuals who either have early rheumatoid arthritis or are developing rheumatoid arthritis over time. When we try to make the diagnosis of rheumatoid arthritis, we are generally following the new 2010 criteria for the diagnosis of RA. The criteria include the number and sites of joints affected, the presence of these rheumatoid arthritis-associated autoantibodies, such as the rheumatoid factor and anti-CCP that I mentioned before, elevation in the inflammatory markers, like the C-reactive protein and sed rate, and finally, the duration of symptoms lasting more than 6 weeks. And by integrating each of those factors, we're able to finally arrive at a diagnosis of rheumatoid arthritis.